So hello guys, what's up and welcome back to my YouTube channel. It's me, your girl Barrister Neze, and this is Nezeville. I am proudly flanked by a very special and senior medical personnel. If you're not new to my channel, I bet you should know Dr. Chia. First, this video is very impromptu. I came to the hospital for an entirely different reason, but I ran into Dr. Chia, and considering the fact that the National Fertility Week just came to an end, I'm like, what more perfect time, what better time than now is it to engage Dr. Chia for him to do what he knows how to do best and give us one or two enlightening words on fertility and related topics. I know that a lot of my subscribers are women and they're going to derive a lot from this engagement. So sit back and let us dive right into it. So, Dr. Chia, just for the benefit of those that are new on our channel, I would like you to introduce yourself briefly and tell us what you do.
My name is Dr. Chia Yonengen. I am a gynecologist. I became a medical doctor since 1997. I've been practicing as a gynecologist for the past 9 years, since 2013. And my business is to help families to birth their children like you.
Okay guys, if I didn't mention, Dr. Chia is the doctor that assisted me have all my children. Yes, he took delivery of all my children, so yes.
And for those
like that.
And for those who are having challenges giving birth, also God help me that I assist them in fulfilling that their reproductive dreams. Try to help them. So all my life is to work with women, work with families, to help them have babies and other challenges, gynecological challenges that may come up once in a while.
Lovely. Thank you, Dr. Chia, for gracing us with your presence and your knowledge, as you always do. So in today's video, we're going to be talking about something I'm going to term the monster called PCOS or PCOS.
Yes.
PCOS or PCOS?
PCOS.
Okay, let's just go PCOS. Today we're going to be talking about what I term the monster called PCOS. A lot of women are dealing with this monster privately or publicly, and Dr. Chia is going to be telling us everything we need to know about PCOS. So my first question for you, Dr. Chia, is what is PCOS and what are the causes?
PCOS is polycystic ovary syndrome. It's a syndrome because there are basically three components. The first component is irregular or absence of menstruation. The menstrues are erratic. We call it oligomenorrhea. The second component is subfertility. People who have PCOS have issues of getting pregnant or of keeping a pregnancy, and then some of them are obese. And then some of them have excess male hormones. We call hyperandrogenism, excess male related hormones. So you have irregular menses, inability to conceive, and then excess male hormones. And that is why women with PCOS, they have a lot of challenges with pimples. Some of them have a lot of hair distribution on their tummy, on their face, on their legs. And then some of them even have hair around their nipple area and all that because of the excess hormones. It's estimated that between 25 to 35% of all women who are having issues, fertility related issues, is due to ovulation. PCOS. Yes, ovulation related issues, particularly PCOS. What happens in PCOS is that every month a woman ovulates. And then the ovulation is triggered from the brain sends signals to the ovaries develop the follicles, and then at a particular size of the follicle bursts and release the egg that is inside, and then if there is an intercourse, conception takes place. But for these women, it is basically a hormonal issue. That is why most times you say hormone imbalance. What is imbalance about the hormone is instead of having the normal ratios of the male and the female related hormones that will now facilitate that normal physiology of ovulation stimulation by natural hormone level, the follicle will grow, the ovulation will take place. Those women don't follow that natural pattern. So they basically don't ovulate as other women ovulate every month.
Is it that there's no ovulation at all, or it's irregular?
Irregular, erratic ovulation. You cannot say, okay, this is when it's going to play, because as a result of that, some of them now, if it affects their normal cycle length, sometimes you stay for to 35 days, sometimes 42 days, sometimes the woman goes 2-3 months without seeing her period.
True. Because
the physiology is altered.
So what is the cause? What are the causes of this?
It's a genetic matter. It's a genetic matter. Science has not been able to really pinpoint exactly where the issue is, but it has been shown to be a genetic matter.
So women that have PCOS were born that way?
Yes, they have the genetic. In men, the gene for PCOS is bald-headedness. In men that have bald-headedness, they have that gene. And the common pathway is that there is hyperandrogen production, high levels of male hormone production, and so the instead of the hormone that now facilitate the growth of those follicles to the size where they are released as ovulation, the high levels of androgens around the ovarian tissue will now frustrate, let me put it that way, frustrate the growth and cause the arrest of those follicles, and then they remain at those rudimentary levels at the size that they cannot grow. They are just plenty there. But they cannot go to the size where they will now ovulate. So if there is no ovulation, there is no conception, no conception, and so that is what happens.
Lovely. Wow, that's so revealing.
Yeah.
So on to our next question. Okay, so Dr. Chia, in the course of answering the first question, you have already touched on some of the symptoms and signs of PCOS. But I would like you to tell us some more in maybe bullet points. What are the symptoms of PCOS?
PCOS can be asymptomatic. That means a woman has PCOS and she does not know that she has PCOS, and she doesn't have any symptoms. She is getting pregnant at the time she wants to get pregnant, or sometimes the woman gets pregnant the first time, and then when the time to get pregnant the second time, the thing is not coming, and then you now go and start checking. Go to the hospital, doctor, I want to get pregnant. Pregnancy is not coming. That is when it is peaked, because her menses are regular, no abnormal hair distribution, no pimples and everything. So everything just looks. So number one is that it could be asymptomatic. The second one is irregular menses, irregular menstruation. Sometimes you skip. Sometimes the menses take a longer time, and 6 weeks, 2 months, and all that to come, and then oily face, pimples, and then a lot of hair distribution, and then some people, they just be adding weight, just be excess weight again. And they have excess weight again because their muscle bulk is bigger than the average women. You see them because of those androgen component of the package of the PCOS.
All right, thank you, Dr. Chia. So my next question, begging for answers, is there a cure, a permanent cure or solution for PCOS? And if not, how can it be managed?
Well, let me say there is no permanent cure, but the treatment, there is treatment available, and the treatment is tailored to the needs of the woman at that particular time. For instance, I have a lot of teenagers in secondary school who are in the boarding house. Parents get worried, they are not seeing their period, they are not seeing their period. What we do, they manage them to be seeing their period now that there is no need for conception. What the first modality of treatment is that is tailored towards the need of the woman at that time. There are some women that, I don't need pregnancy, I just want to be seeing my period regularly. Well, it's something we do for them to be seeing their period. If it is pregnancy that is the issue, we treat them to get pregnant. If it is
just to feel normal,
it's okay. Well, I just want to know that there is not a problem. I don't know because I'm supposed to see my period and all that. Well, if the period is not coming regular, it's not my business. We just leave it like that. I just want to know, but I don't want to do anything. You also leave them like that. So the treatment is based on the need of the person at the time.
Okay, so it's common knowledge that infertility is a cause that can arise from PCOS. Apart from infertility, what else? What are the long and short-term effects of PCOS on a woman?
Apart from infertility, because of those hormonal issues, some women battle with obesity. And that is why in the management of the condition, weight reduction is a very, very important component of the treatment. In that case, so women battling in obesity, those are the immediate. And then it's also been associated with women who have PCOS also have another higher risk of having diabetes mellitus in their lifetime or later in life. And then because the obesity platform also offers that diabetes and hypertension. And then later in life, because of the irregularity in the shedding of the endometrium, they are always prone to having what we call the endometrial hyperplasia. The lining of the cavity of the womb where menstruation takes place, that is shedded during menses, keeps piling up and keeps piling up. And so these women are prone later in life to having endometrial cancers. Yes, those are the long-term effects. And because of that, the obesity, the diabetes, and then later on in life, they may be prone to having endometrial cancers. And that is why in the management of polycystic ovary syndrome, even for women who don't desire pregnancy, we usually advise that the endometrium should be shedded if the menses does not come for up to 2 months. You give them medication to shed it so that it will not pile up and then undergoes metaplastic changes that will now lead to something that you would not like to have in your later time.
Lovely.
Yes.
I love how you hit that straight on the nail. Thank you, Dr. Chair.
Yes.
So our next question is, a lot of people confuse ovarian cysts with PCOS. Are there any differences, or are they both the same thing?
They are different. In polycystic ovarian syndrome, let me just say that in the making of the diagnosis, you look at the symptoms, you look at your investigations. In investigation, you do a transvaginal ultrasound scan. And then in the transvaginal ultrasound scan, if you look at the architecture, the appearance of, when you do a transvaginal ultrasound scan, the ovaries appear in what is described as a necklace beads appearance. Like a woman wearing a necklace of beads. The small follicles, we call them the antral follicles, they are just on the periphery around, as if a woman is wearing a bead around her neck. They are very, very small. And then you look at the thickness, what we call the ovarian stroma, is very thick. But those antral follicles, they are very tiny. In ovarian cyst, but let me also say that every month a woman develops a cyst in her ovary, which is an innocent thing called ovulation cyst. Okay. We call it follicular cyst. And that cyst grows from the beginning of the menstrual flow till it now gets ovulated and it bursts and the egg is released. So in ovarian cyst is those growth that are on the ovary with a lot of fluid inside, and then they range from different sizes. Those cysts that are below 5 centimeters, we don't give them any serious thought. But by the time they are growing bigger than 5 centimeters, and then there are other things that you look at on the ultrasound scan, and then you begin to say, okay, this one is a bad cyst, or this one is not a bad cyst. You can now look at that. So there are two different things. Polycystic ovary syndrome, there are tiny cysts that are just scattered at the periphery of the ovary when you do an ultrasound scan, but the cysts that you now see ovarian cysts are those other bigger ones that just occupy the part, or sometimes they take over the entire of the ovarian tissue, and then usually growing there. They can be very big, they can be small, and all that.
Can they cause infertility too?
If a big cyst has taken over the entire ovary where the ovulation takes place, why not? It will cause infertility until that cyst is released and is removed from that, and then you release the normal ovarian tissue that can now produce the follicles that have an egg inside. The woman who has a big cyst that has taken over the entire ovary will not be able to get pregnant, because where will the egg grow from?
Okay, you spoke about the possibility of managing PCOS and achieving conception even with PCOS.
Yes.
Under what circumstance would you then advise a woman with PCOS to resort to other alternative mechanisms of conception that is not natural?
Yes. The first thing to do is usually you follow the conservative approach, what we call conservative approach. You advise for weight reduction. It is estimated that if you lose 5 to 10% of your weight for the women that are obese, their menstruation will become regular, their ovulation will be restored, and then some people can get pregnant on their own.
Okay.
Now, if that does not happen, you combine lifestyle modification, in this case diet and weight reduction, with drugs. We give them mild ovulation stimulation drugs to see, because the basic abnormality is in that ovulation. You have to stimulate the ovaries to produce the follicles that will help them have the egg to get them pregnant. Now, there are some of them that they are so stubborn that no matter the amount of medication you give, they may not get pregnant, or they may not ovulate, and even when they ovulate, you are not sure that the egg is inside, because they have tendency to have premature eggs too, and if the eggs are not matured, they may not fertilize, or even if they fertilize, pregnancy may not take place. Even pregnancy take place, may not see the light of the male implant and all that. So when you now have that, you stimulate them, they are responding, but they are not getting pregnant, or they are having issues with response, or they are getting pregnant and have what we call recurrent pregnancy loss, with hormonal support of the pregnancy. Then at that point, if you try and then you are not having good success, then you can now advise that yes, they may need to go for assisted conception, where they will now stimulate them, collect the egg, fertilize, and then get the good embryo implanted in their womb. Yes. So that is how it is done. We do conservative approach, lifestyle modification and diet first, weight reduction, and then ovulation induction with medication. Now, if these ones are not working, then you are advised to go to the next level of management of care, which is assisted conception.
Lovely, lovely, lovely. Guys, I am getting so much from this. On a personal note, I've not really struggled with all of this, but this is so enlightening. I believe that every woman, we share in the same pain, we share in the same process, and when the next woman is having challenges having a baby, it tells on the other woman. So I'm really taking a lot from this. Don't forget to give this video a thumbs up if you are. If you have any questions, or if you would like to reach Dr. Chair, you can drop in the comment section, and I will later on get back to us on how we can get to him. So please give this video a thumbs up and drop all your comments and questions in the comment section. Of course, there will be more and more videos to come. So let's go to our next question. Okay, Dr. Chair, you mentioned earlier about ovulation stimulation.
Yes.
And it's usually one of the treatments that are adopted treating PCOS.
Yes.
So tell us a little more about ovulation stimulation.
Yes, ovulation stimulation is all about trying to give a woman medication to stir up, to push the ovaries to produce the follicles that we think we could have the egg inside for possible conception to take place. It's basically you use medications, drugs. There are oral medications, there are some injections, but the injections are reserved basically for people who go for assisted conception. If you go and meet your gynecologist and then he diagnoses you to have PCOS, and then he will tell you that I'm going to give you medication that will help you to ovulate, they give you those medications. There are a lot of them. There are ones that are better, they give you better chances of conception in PCOS than others. Your gynecologist will be able to tell you exactly which one he is very conversant with and which gives him success. The principle there is to produce plenty follicles and then go and retrieve them and then fertilize them and then get the embryos prepared to be transferred into the egg. So the ovulation stimulation protocols or modalities are different, and it's also tailored based on the need of the woman, the experience of the gynecologist, or even the doctor managing it, and then which one gives him success and all that. No one is superior to the other, but when you begin to practice, you just discover that this is the one that gives you more results, and then you go to the scientific literature too. You now discover that, oh, if you read about this one, they say, oh, this one gives you all this. If you take this one, it gives you more of this. These are the side effects. If you take this one, you are more likely to end up with multiple pregnancy. You are take this one, you are more likely to end with one pregnancy. The chances of having pregnancy with this one, if you combine the two, these are the results and all that. So that is what we look at basically when you are considering the ovulation stimulation protocols for people who have PCOS or who need ovulation stimulation. Yes.
All right. So let's move to our last question before we wrap up this video. So talking about treatments and finding solutions to for a woman suffering from PCOS, are there any surgical treatments or remedies that can be employed to treat or tackle PCOS?
Yes, there are surgical methods that have been available, but because of the improvement in the science of PCOS and the assisted reproduction that is available now, before now they used to do what they called ovarian wedge resection. They do a surgery and take a V-shaped component of the ovary. The essence is to help to reduce how do I put it now? The ovaries are stiff, so to say, and they are not being able to release those follicles that are trapped inside. So when you do that, you reduce the bulk, and then you help to release the ovaries, and then the woman is now able to ovulate on her own and then get pregnant. As time went on, they now what we call laparoscopic ovarian drilling. There is a special device that you drill holes on the ovary. The essence is to try to be able to loosen the toughness of the ovarian tissue and help to release those follicles from the places where are trapped, and then release them. So those are the surgical methods: wedge resection, laparoscopic ovarian drilling procedure. But most times, because of the improvement in science, ovulation induction methods, and then the assisted reproduction, nobody bothers to now put a woman all through that stress. You are not getting pregnant with the other conventional methods. You go for assisted reproduction, and then you get pregnant. Last year, we had triplets.
Really?
Times 3.
Wow.
Because of that.
Wow.
They just came. They couldn't get pregnant with IVF, and then ended up with triplets. So
that is beautiful.
Yes.
It's so relieving to know that with science now, a lot of people are breaking through this infertility journey and having their dreams come true. Thank God and thank science. Our last question is, what is a woman going through hormonal treatment to expect? A woman going through PCOS and hormonal imbalance treatment, what is she to expect? What are the changes she's to expect in her body, in her mood, and all of that?
The good news is that a woman who has PCOS is one of the causes of self-fertility that are treatable with medications. That is the good news. It is treatable with drugs. Results are different. People respond differently, but the good news is that it can be treated. It can be treated. So if you say, oh, you have PCOS, the modalities are very straightforward and they are simple. If you follow the rules, it is just within 1 year, 6 months to 1 year or so, you will get your results. Say for instance, a woman comes and say, okay, this is PCOS, I know you discover this PCOS. The first month you give her the medication, she gets pregnant, it's twins, or she gets pregnant. Let me give you a testimony. When I was in Jos, there was a young lady, just got my 25 years, and she was having these PCOS, typical symptoms, and I wanted to give her the normal, this, and I said, no, doctor, don't worry, just give me the medication. And guess what? The first medication she took, she had twins. And so you shouldn't be discouraged. Be patient. You follow with your doctor's advice and do follow the instructions. Those medications sometimes they will give you some little side effects, but just bear it. It's just a matter of time, you'll get to it. And if it's wasting too much time and you are getting frustrated, move to the next level and all that. It is something that is treatable. That is the take-home message. A lot of people are here who have been taking herbs, have been taking this, have been taking this. Well, at the end of the day, some claim that it works for them, because everything about life is faith. If you believe in anything, it will work for you. And so, but what we say is that if you have PCOS, don't be just worried.
Don't feel hopeless.
Hopeless. Come forward and then consult with the doctor and gynecologist, and then they will put you through the process, and then you will get pregnant. It can be as easy as that. Yes.
Wow. Thank you so much, Dr. Chair, for everything you have said. I'm sure that I have learned so much, and I'm very certain too that our audience have learned a lot from all your answers. Thank you so much, guys, for watching. Don't forget to share this video to every person that you believe would have need for it, or that it would go a long way to help. If you enjoyed this video, do not forget to give it a thumbs up. Drop your comments, questions, and inquiries in the comment section. Do subscribe to our YouTube channel and stay glued for more, because there's going to be so much more coming your way. It's me again, your girl Barista Neze, and this is Nezeville. I'll see you guys in my next one. For now, bye.